Good afternoon, everybody. My name's Jackie Scott. I'm an alcohol recovery worker at Burnley Inspire, and I'm here with my colleague, who's a peer mentor, Craig. And what we're going to do this afternoon, as part of Alcohol Week, National Alcohol Week, is we're going to talk to the healthcare team, and we've got a series of questions. We're going to bombard them actually with lots and lots of questions. A bit about them, a bit about the way they work, and questions that service users have put to them as well. So we're going to put them on the spot a little bit this afternoon. Craig, do you want to start? Oh, hang on. Shall we have some introductions? That'd be good. Paula, do you want to just say who you are?
Hi. Yeah, hi, I'm Paula, health and wellbeing nurse based in East Lancashire. I've been back at CGL for only a few months now, but I worked there previously. I'm mental health trained nurse. I don't think that sounded right, did it? But mental health trained. I've got experience in mainly working with substance misuse, but also working with adolescents on a psychiatric intensive care unit. So that's a bit about my background.
Thanks, Paula. Wayne.
Hi, my name's Wayne. I've been working with CGL for a few years now. I'm a registered nurse in learning disabilities, and I later did my conversion to mental health, so the dual aspect there. The only experience in substance misuse I had prior to coming here was when I was doing my training, and then I did some time with the substance misuse team and absolutely loved it. So when I was looking for a career change and saw this, it was the right move. I've been loving it.
Thanks, Wayne. Thank you. Joanne, do you want to tell us a little bit about yourself?
Hello, my name's Joanne Doherty. I'm a nurse within East Lancashire working for CGL. Worked for CGL 13 years now. Started off as a nurse in mental health, and actually did some of my training for substance misuse services back kind of 15 years ago, and immediately loved it whilst I was a student working within substance misuse, so both alcohol and drugs. And so when I decided that I wanted to specialise and go to a particular area of mental health nursing, substance misuse was my immediate choice, for which I've never left, and I'm still here. So it's a great experience, and I love every minute of it.
Well, thank you, Joanne. And last but not least, Pippa.
Hi there, I'm a health and wellbeing nurse, and I'm based at Burnley at the moment. My background is quite different, I think, to some of my associates. I come from theatre anaesthetic nursing in the past, but I have come up through service as a volunteer, and I've been working for several years as a nurse here, and it's really exciting work. I'm enjoying it immensely.
Thank you, Pippa. That's great. Craig, do you want to start with some of the questions? Put them on the spot.
Yeah, my first question for everyone is, what was your motivation to work in this field? To start with, Paula.
With me? Initially, when I was a student nurse, I had an interest in substance misuse then. So when it came to the final year, I elected to do a placement at Inspire at Burnley. Absolutely loved it. And then from then on, I thought, this is what I want to do. So that's where that came from. Loved it. Still do.
That's brilliant, thanks. What about yourself, Wayne?
Again, when I was doing my conversion from learning disabilities to mental health, I had the opportunity to work with the substance misuse team over in Calderdale. So I guess it was from there. I mean, I went on to do other jobs, but then later on when I was looking at a career change and I saw this opportunity, it was because of that placement I did.
Brilliant. Can I come to you, Joanne?
And a little bit just the same as like Paula and Wayne, I did placements within substance misuse and prison work as well, and enjoyed substance misuse. I think there's a little bit of a personal factor. I have some close friends and family members that had also experienced substance misuse and alcohol abuse, and so that too gave me an interest in trying to help other people.
Right, thanks a lot for that. And last but not least, Pippa.
Hi. As I said before, my introduction to the service was actually as a service user. I went on to volunteer and really enjoyed the work. So I decided when a position became available to use my nursing skills to good use.
And thanks everyone for that.
Brilliant. Thank you. I think this might be, they're suggesting just one or two examples and there's four of you. So I'm going to go for Joanne first. Joanne, what would you say were the biggest successes of your role?
I think right at this moment, probably currently it'd be a good place to start because we've had all the pressures of coronavirus and COVID, and work's been very pressurised, I guess, not just for us nurses, but for our patients out there, service users out there as well. But in this time, it's proven that we've still all managed to do the best we possibly can. And as far as alcohol detoxes are concerned, that's worked amazingly. People have continued to have detoxes in the community and at home, and achieved really, really well. In fact, we've probably got more detoxes this year than previous years because people have really started to focus on their alcohol use. Whether that's because it's escalated due to COVID or not, people are really getting the support that they need.
Thank you, Joanne. Pippa, can I put that same question to you? Do you want me to repeat it?
No, I don't think so. I think the great success is that keeping the service running in these difficult times, and that we have had plenty of successes. People are in recovery following treatments with us, and it's there have been lots of successes. Like Joe says, we've managed to do more detoxes than we did before. We've adapted very well to the situation because it's not due to end any time now. So we are very success-based. We see all the steps that people take are really important. And I know every morning we have a meeting, we have our flash meeting, and every morning we talk about our successes. Every little step is important.
Oh, thank you, Pippa. That's wonderful. Wayne, do you want to share?
I guess I'm going to echo what they said, but I guess I will go for when I've done a good job and I actually get some feedback from people that I'm working with. I do like a bit of praise, and when yeah, absolutely. And when I get that from someone saying that was really helpful, you've been out there, lift me up a bit.
Yeah, I don't think as nurses you could really do the job you do without that's meat and grist. It's certainly not the salary, is it?
No.
It's that sort of that relationship you have with your clients.
Yeah, absolutely.
Paula, last but not least.
I echo what my colleagues say. It is great to be able to adapt to such a difficult situation and be able to deliver a continued good service to all the clients. But it is about building, therapeutic relationships with people, which can sometimes be a little bit difficult when it's over the telephone, because in normal life, they come in and see us, and we go through that journey with them. But it does make you feel good when, someone's going through that journey and they do maintain abstinence and they're able to, continue that and live a good life without alcohol. So, I've only been back a few months, but I've done my first detox, which went really well. So you do feel satisfied. It gives you job satisfaction when somebody's gone through that and they come out the other end. So it's good. Feels good.
Oh, thank you, Paul. Just hand over to Craig now.
Yeah, our next question for everyone. It's open to anybody to answer this. What are the biggest challenges that you face in your role? Anyway?
I think during COVID has been very challenging for us because Obviously, we can't see people, although we can use WhatsApp and things like that, it's not the same. So prior to starting a detox, we need blood pressure, we need all these things from people, and we're unable to do that really, because we're not seeing them at the moment. So I suppose a challenge really is trying to set eyes on somebody and actually make sure that they are okay, because over the phone, they can say, yeah, everything's fine, but sometimes it might not be that way. So I think for me, the biggest challenge is not being able to actually physically see people, because I miss seeing them. We are social, we are social creatures, and it is difficult. It can be difficult, although we have overcome that. But for me, it's not actually being able to see them in person. That's been one of my biggest challenges.
I think as we're getting a bit better at doing Zoom, it becomes more real, that screen work.
Yeah.
I don't think they do. I think it is really a scary thing, isn't it?
Yeah, and the feedback from them is, it'd be great to come and see you, and and it would be great to see them, because that's what we do. We're used to having busy services with people coming in and out all the time, and there's none of that. It's very, very different.
Thank you, Paul.
Yeah, I do hear that from people throughout the service, really, that what they miss is that person-to-person contact.
Yeah.
Zoom's good, it serves its purpose, but it's not the same as sort of having somebody in the room. Yeah.
I think one of the problems we've encountered has been that not everybody has had IT facilities or even phones, but over time we found ways to access more ways to contact people. There are schemes out there that are helping people to communicate, and people are getting used to it, but there's still room for more, because I, like everybody else, miss the face-to-face, but we want the service to continue to run effectively and people to be able to achieve their goals.
Fantastic, thank you. So those were kind of like our introductory questions that we were given. Now we're going to move on. It's a little bit more of a challenge. So we've got some frequently asked questions, and we've got some actual questions that service users have given us to pose to you. I'm going to take one now, Craig, that I've got on my notepad. It's not one of the ones that we've been sharing on the email, so it's one that you've probably this question, so what you have to do is you have to imagine that I'm going to put this question to Wayne, because everybody can't answer the same question. It would be daft, wouldn't it? So you imagine the service users talking to you and ask the question, how long will it take for me to feel different physically? And this is once they're abstinent.
After they're abstinent, I guess I would say to that person, I'm not going to be able to say when they're going to feel different. As far as alcohol is concerned, if they're abstinent, then they should no longer be experiencing withdrawals. And if they are, then maybe that's something that needs to be taken into consideration. Different in terms of withdrawals or different in themselves. I don't know. If someone's experiencing withdrawals, then they're still being supported by us. A detox will take maybe a week. So you could say a good week for someone maybe to be consider themselves detox, but different in terms of more energetic and more going out and less inclined to hide away. That can come very quickly, I think, as soon as you start doing something positively. Yeah. Detox of the week.
To add to that one.
I think when you become abstinent in your recovery, it varies from person to person how quickly it becomes your normality. I think it's normal to think about, say, alcohol or substances in the initial stages of your recovery quite often, and to experience cravings, which will pass. Come in waves, do pass. But as time goes on, you'll find that you won't be thinking of these things every day. But I think it varies from person to person how long it takes to become the normality. But I think over time it doesn't become, it's less acute. It isn't there on your mind all the time. Life goes on without it.
Thank you. Those are really encouraging things for people to hear that are listening. Craig, have you got something you want to fling in?
Yeah, I'm just looking at a frequently asked question, which is, how do I know my drinking is an issue? So people who may be sort of contemplating whether to stop drinking or carry on drinking, how would you answer that question? How do I know my drinking is an issue? Can I ask that to Paula, please?
Well, it varies really, because the recommended weekly units that the Chief Medical Officer recommends is 14. So that's for safer drinking. But it varies with people, because some people might drink a bottle of wine a night and think that that's okay, and then other people might think that that's not an issue. So it all depends on the impact that it's having on your life. If things are changing, it might be that, you're not seeing friends and family, you are hiding away, you are starting to tell a few fibs with, how much you're drinking and things like that. So it really depends on the individual and the environment that they're in. And anything over 14 units is classed as harmful, so people need to bear that in mind, because some people are not right sure about units. They get a bit confused. They might say, I drink half a bottle of wine, and they're not sure how many units are in that. So it just depends really on what impact it's having on your life. If it is impacting on your life and it's, you're not going to work, or you're sick, or it's making you ill, or, there's lots of different factors that can affect that really. So there is, I think there's apps out there and things that you can go on to see if your drinking's out of control, or if it's within safe limits. But they can always ask, can always ask the question to us, in service or something like that.
I think sometimes the question isn't so much how do I know my drinking is a problem, but more, I do know my drinking's a problem, but I'm just not ready to address it yet. I think at times, we do know it's a problem. It's like when you're smoking, you know that it doesn't do you any good, but you still sometimes hear people say, no, I enjoy a cigarette and I'm happy to smoke, so I think sometimes it's am I ready to acknowledge that I've got a drinking problem?
I think if you're contemplating the question, chances are there is an issue, because if it's popped into your mind, it's not usually because things are as they have been. It is usually because it's having some kind of impact on your life and relationships and finances.
Yeah, you've probably already answered the question by thinking, is there a problem? And really, you've got a gut feeling that yes, there is, and is now the time to sort of have that clarified by somebody else, possibly.
Thank you. Thanks very much. Okay, well, do you know what? You've probably covered between you all 4 questions that were in the section labelled alcohol. Just we can strike through that, so we're tearing through. I'm going to ask you a question now with regard to treatment. And this is a service user who says, my family is struggling and I don't understand that you're telling me not to suddenly stop drinking and to continue drinking safely.
This is something that crops up quite a lot. And I think it's more about awareness around alcohol, because people don't understand, or people don't know, because it's not made known to people, that if you are to suddenly stop drinking, it can have serious consequences on your physical health. It can lead to severe withdrawals and it can lead to seizures. So sometimes if I'm speaking to somebody and they're saying, a family member has said to me, I just need to stop, then it's about educating that person about the effects of alcohol and how dangerous it can really be. And generally they don't know. So if you don't know something and you're not aware of it, you will say, you need to stop doing that. So it's about educating people about alcohol awareness and making them know that it is very dangerous for somebody to do that.
I'd like people to remember we are available to talk to family members to increase their understanding. We are there because I think alcohol and substances, they are things that affect the whole family. So we don't just work necessarily with the client. We are there for the family, and we can advise and we can clarify things with them also.
We also provide family support services, so they recognise, that these things affect not just the individual, but can affect the family as well. So that's another service which is there for family members.
Thanks, Wade. Joe?
Yeah, I think on the back of what Pippa said, I always find it easier to, if I have somebody on the telephone, particularly saying, for example, my mum says I can't bring any more alcohol in the house, I've got to stop now, immediately, it's not allowed to come in. I think it helps for one of us to get on the phone and actually have a talk with mum, so that they can then start to understand why we're giving that advice and what the consequences would be should they not follow that, and how their loved one or family member may suffer some, ill effects should they suddenly stop drinking, and that it's the requirement of treatment, and that we can support family and them.
Thank you. Thanks very much.
Right, the next question, why should I take thiamine tablets? Wayne?
Okay, so people who problem drink are usually thiamine deficient. So thiamine B1 is a vitamin, and it is to bring up the levels of thiamine. Deficiency in thiamine, that's someone at risk of dementia, so that would be Wernicke's and Korsakoff's. So the thiamine is there to reduce the risk of someone getting dementia. If someone stops drinking, then we would sort of advise a person maybe to continue to take the thiamine for up to maybe 6 months, and maybe stop it with discussion with the doctor. But essentially, a person should take thiamine to reduce the risk of them getting dementia.
Thanks very much.
Also, there is no problem if you're not deficient in thiamine, if somehow your diet is so rich in vitamin B1 that you're not suffering from any of the deficiencies that are associated with heavy alcohol use. It is harmless. If you've got enough, you'll just wee the rest out.
Oh, that's really important. That's not important to know, isn't it?
Yeah, so it's not going to be harmful to take a prescribed dose, even if you're not deficient. And the risk of not having enough thiamine coming in, and the damage that can happen to your brain, especially, it's crucial to take thiamine.
It's also important for your heart and your cardiovascular system as well, and your nervous system, because people can have a lot of problems should they be deficient in thiamine. So we encourage them to take it for that as well.
Thank you. Okay, this is one, even in the work that I'm doing, I'm hearing a lot, which is it's a real pain to have to keep a diary of me drinking. Why do I have to do it?
I'd say if you're drinking, often you become intoxicated. When you become intoxicated, it's difficult often to remember exactly what you're drinking. And over time, people have quite a woolly idea. Everybody does, about what their alcohol intake is. And actually to see it on paper, to see what you're having in the week, it does sort of, it makes it clearer to yourself what is going on. But I think just to rely on your memory isn't always enough, really, to base a starting point for your treatment on.
It's one of the tools which we would use to accurately measure what someone's drinking, so we can safely advise on treatment.
Thank you. Anybody else? Anything else?
I think if people do a diary, because sometimes when they come through, they do say, oh, well, I'm drinking this, I'm drinking that, I'm drinking the other. So I often encourage drink diaries because it gives them a visual aid so they can see what they're drinking on a daily or a weekly basis. And then when we follow them up, well, I do on a weekly basis, I say, right, let's have a look, let's see what you've been drinking. And then it's for them and it's for us as well. So I found people do tend to do it, you know, sometimes they will do, sometimes they won't, but it is a good visual aid for them also to see where they're up to with the drinking.
Thank you.
Why do I have to attend one-to-ones and group sessions? Anybody?
I think sometimes people do come and they've got a very clear, I want medication for a detox and I want it now. And totally get why someone might want that, but there is a process, and it is shown that people who maybe don't sell their soul to the process and sign up to something relapse, you know. And what we're trying to do is trying to support someone to get from where they are to where they want to be, and maybe sustain that. Going through a process of signing up to the psychological aspect of being a person who doesn't drink supports them to maintain abstinence. That's their goal.
I think it's important for them to attend one-to-one because it gives a distraction to what's going on, gives them some kind of purpose in the week. It's going to sometimes improve self-esteem as well. It's getting them to connect with other people. It's giving them visual recovery so that they can see that they're not on their own on this journey, and they can look at other people around them and, you know, maybe even sit within that Zoom session or within that room and recognise that one of their peers who's supporting them and going through something similar is recovering well. Then it's inspiring for them then to do the same, and visual recovery works really well. It's about giving the service user some responsibility as well to attend and evidence their sort of desire to get into recovery, which also helps the process of them getting the detox, maybe funding for detox or rehab. And it gives them good reflection tools and connects them with other people, which is all a huge part of the recovery as well.
I think people are often very, very focused on the detox element, but that is just one part of it. And detox is just the method by which we are removing safely the problematic substance. The evidence out there is overwhelming that people who prepare for their recovery and their journey into sobriety and without substances, and then continue to access that support into the post-detox period, do have a much higher rate of continuing success with their sobriety.
Thank you. Thanks, everybody. Again, you've done really amazing. You've whisked through the treatment questions. Just with like a few pointers, you've teased out all the answers to the other questions. So I'm going to move on to detox now and see if we can do the same thing with that. I'm going to pick the question. It's not the first question on the list, but it's an interesting one. What's the difference between an inpatient detox and a community detox, and which one's got more success rate? And I'll put that one to Joanne.
So a community detox is where somebody can detox from alcohol at home. It looks quite indifferent to what an inpatient detox looks like. So if somebody was to have a detox at home, that would be myself, Paula, Wayne, or indeed Pippa, that would support them through that process for a period of 7 days. We would be calling them several times a day to ask about the well-being, to ask about withdrawals, to oversee the medication, and we would have planned and prepared for this detox in every eventuality as well. And also they would have an aftercare plan. for following this detox. So that's how it's done at home. The criteria for home detoxes used to kind of stipulate that you have to have somebody there to support you at home. However, due to coronavirus and COVID, that's not been possible for all people having to socially distance or not be in contact with others. So we have been holding detoxes, support of us over the telephone and support from family members over the telephone without somebody actually residing in the property. So that's been a huge leap forward that has proved to be really successful as well. When somebody is having an inpatient detox, it's deemed that they may require a little bit more intensive support. It might be because of a physical ailment or disability or some mental health concerns or some kind of reasoning why it would be deemed more appropriate that they've got supervision 24/7. They would go into a detox unit for that, still round about the same length of time, seven days plus, but they would be away from home in a residential unit.
I think the choice of pathway, whether it be community or inpatient, is mainly is taken really predominantly to maintain people's safety throughout the process. And so if people often like the idea of a home detox, but if we think in any way that lack of supervision because of underlying medical, for example, problems will render the process unsafe, then we will move to a inpatient detox. It's about safety.
Thank you.
I think we covered most of detox.
You're amazing!
Very well explained, detox there. So shall we move on then, Jackie, to the next section?
You know what? I want to go a bit off piste. I want to go to one of the nurses sent in.
Okay.
Questions. Have you got that, Liz?
No.
All right. Okay. So, actually, a lot of them are covered. What can I do to help my liver? Come on, no, you can. Yeah, you've got that in now.
Popular question.
What can I do to help my liver?
Well, immediately cut down on your drinking is automatically going to help that liver get better, hence why we're all here. So that's going to show some immediate success with your liver getting better, is reducing your alcohol or indeed stopping it. It also comes down to your diet, exercise, any toxins that you may consume whilst somebody's consuming alcohol, then your liver really sort of struggles to eliminate any toxins from your liver. So
you've dug yourself a hole here.
Oh, go on.
Where are you going with the diet concept?
So lots of green leafy vegetables will help with your diet.
Thank you.
And sort of kale, cabbage, try and avoid fatty foods certainly. Smoking even as well can be harmful to your liver. Try and have organic foods rather than foods that may have got pesticides on, because then your liver's only got to tolerate those toxins as well.
I think swapping the alcohol, if you're able to, for water is if you're ready. Drinking water is
I'm glad you said water, because a lot of gimmicky things, this is me speaking personally as a service user, a lot of things which are out there that are supposed to help you, changing your ways of drinking and things, will offer you the quite exotic, quite expensive drinks and detox potions and juicing options, and it really is quite expensive to do juicing if you're on a low income. So the fact that you've said water and that water's good, it's okay, that's really helpful.
Reducing your alcohol safely is the best way to rest your liver, and your liver has to rest, not work so hard in order for healing to take place. So it is important to reduce the alcohol to do that, but never in a dangerous way. Never just go cold turkey because you want to give your liver a rest. It always has to be done in a safe way. That's no more than 2 units of alcohol. That's a can of wheat beer or a small glass of wine. That reduction should only take place every 3 to 4 days, those 2 units. Any more is dangerous to your body. So whereas you want your liver to have a rest as soon as possible, it must always be achieved safely.
Thank you.
Can I just say as well, going back to water will keep you hydrated because alcohol dehydrates you. So if you can, in between alcoholic drinks, drink some water. It'll be better for you.
Oh, that's helpful. So you're talking about in the interim phase. So when someone is actually still drinking, but they're moving towards detail.
I always advise my clients, if they can, to drink water or juice, cordial, something like that, something that's hydrating, because it does dehydrate you. So it'll just give them a bit of a perk.
Thank you. That's loads of information just on that one question. That's great.
Well, actually, that covers the first point of the next section, which is safety. So we've already mentioned a safe way to reduce alcohol. The next question is, I'm frightened of having an alcohol seizure. How do I reduce this risk?
Into a service would be the first step. Rather than going it alone. A lot of people try and stop abruptly, and they come to us after having a seizure. So coming to a service so we can advise. Usually before they got to us, they've had an assessment to determine their level. And the get-go is, don't just stop drinking, because that it has the potential of putting your body into shock and your body having a seizure. Then my first thing I would want to do is work with someone and try and understand the extent to what they're drinking. From there, I would be looking to tell the person how important it is for them to stabilise, as opposed to going up and down, up and down. So the person understands, or their body understands, this is how much I'm drinking. Then we can start to introduce a safe reduction plan, which Pippa talked about. So the importance is really is not on any quick stopping abruptly. That's a no-no. It's kind of working with us, stabilising, and then letting us introduce a safe reduction plan.
I think something that can seem a bit contradictory, which we might ask people to do, is there are people that follow a pattern of drinking a lot one day and then not really drinking the next day and going through withdrawals, drinking the day after, not drinking the day after. And we might, in that case, advise you to drink every day, but at a more even amount, because it is very stressful for your body to constantly go into withdrawals. And also it is potentially very dangerous, because seizures can have catastrophic consequences.
I did get told actually a few years back when I was talking to a detox nurse that was very hard to work with, because I was so erratic with my drinking. So sometimes it was really high, other days it was really low. So I understand what you're saying there about stabilising. Yeah.
It's really important to maintain stabilisation. And this is the only job where you do say to people, you need to go and have a drink. And they're like, what? But we say it's really important to keep yourself safe because you are at risk of seizures if you just abruptly stop or reduce too quickly. So it is really important. You know, alcohol is the only substance that can cause these effects, and that's the issue with it. You know, it can be really, really severe. So we don't want people to feel like that. We want them to be as comfortable as possible, and we want them to be able to understand the reasons why we're saying what we say. So it is really important. If you are thinking about, stopping or you want to reduce, get some advice first. Don't do it on your own. And it needs to be done slowly and safely and in a structured way.
Thanks.
Just gonna add. I picked up something off my manager when she was speaking to someone when we were advising, if you've got withdrawals, you need to drink a bit of alcohol. And that sounds, it does sound, maybe it doesn't sound great, but when it's put into the context that you're treating the alcohol in this instance as medicine. Mm-hmm. So you're having, your body's going into shock, and like medicine, you're going to have a little bit to take your body out of shock. That kind of puts what you're doing in context, rather than jumping into a litre of vodka. What you're saying is you just have just enough alcohol so your body comes out of the withdrawal symptoms. So that's quite useful, I think.
Sometimes we speak to people and they've not had a drink because they've got an appointment with us and they somehow feel they shouldn't have a drink before. And absolutely, you must have a drink if you're dependent on alcohol, whether you're speaking to us or not. What we would ask, though, is not to become so intoxicated that the conversation cannot be productive. But we don't ask anybody to abstain from alcohol prior to speaking to us, because that, again, can lead to withdrawals.
It's all really useful stuff. Really useful stuff. Did you have something else to say, Jo?
No, I was just thinking of, in relation to Craig's question about people being frightened, particularly about seizures, that obviously if they, kind of following the advice of stabilisation and they're not reducing too quickly or abstaining suddenly, which is the highest risk of seizures. The only other thing that can sometimes kind of lead to seizures, and that we may see in some of our clients, is other illicit substances that might be used all over the counter medications that could be bought, because those two are quite toxic and can have an influence on somebody suffering a seizure at that time. So antibiotics, over the counter medications, and also illicit medications in conjunction.
Goodness me, that's a lot of food for thought, isn't it? Again, we've covered quite a bit of stuff there, but this is a natural roll on from that, because we've really focused on seizures and we're focused on the dangers of detoxing suddenly without any support. But what other symptoms do I need to look for when reducing or abstaining from alcohol?
Common symptoms people get are sweating, tremor, whether it's of the hands or feeling like it's coming from the entire body. Upsets with your stomach, that can be retching when you wake up, nausea, vomiting, a general feeling of uptightness, agitation, increased anxiety, headaches, insomnia. These can all be symptoms of withdrawals.
There's a really good website I found. If you type in Google and type in timeline for alcohol withdrawals, there's quite a nice little, and it's got the time frame, and it sort of gives you, I think it's quite a good thing to refer to. I mean, Google.
I used to look at that feverishly when I was and I could probably recite it.
We all use Google, don't we? Google's a great thing.
Yeah, but I think the thing is, I think most people know Google's out there and it's got this stuff, but what this sort of discussion does with people who are credible witnesses is it firms it up and it helps people to cherry pick. And that's a really good example, Wayne, of you giving something that's accessible on the internet, but that you're vetoing. That's okay. They can look at that.
Yeah.
Okay. So, I've not had a drink today and I want to start my detox. That's on a phone call. What would you like to be?
I think, as we discussed before, detox is only one part of the recovery process. And unfortunately, it was in the past very easy just to say, go to the GP and get some Librium. And this did happen in the past. So you'd wake up one day, you decide that was the day you wanted to detox, you'd get some Librium. But actually, it wasn't associated with a great success rate at all in maintaining sobriety afterwards, because it is the psychosocial aspects and that aspect of support are really, really important.
Thanks, Pippa.
I think I'd remind someone that in order to do it safely, that we also need bloods. We need to make sure everything's a process is followed. So we can do it safely. So yeah, if someone's had their bloods, someone's engaging in support, they're moving to readiness, and then we can plan for a detox.
Fantastic. That's all really good, solid stuff. Fantastic. Craig?
Yeah, another statement that somebody might say to you: I've been thrown out of my home until I stop drinking and I need help. How would you respond to that? Tough one, that, isn't it?
It is a tough one, yeah.
Well, we couldn't advise on them to stop drinking because stopping abruptly comes to seizures. They're without house, so do they have housing issues? Are they going to stay with a friend? So their main priority may be housing straight away. So yeah, it'd be having a conversation with that individual to see exactly what their arrangements are. It may be to go to housing benefits and get themselves home and housed.
I suppose the message there is don't just stop drinking.
No, don't stop.
Back home, yeah.
Don't just stop drinking, and it might mean, like we talked about before, a conversation with a family member who, why they've been chucked out, and have that conversation with them and try to give them a better understanding of what's going on and explain the dangers of just suddenly stopping drinking. So again, it would be like like an holistic approach to the problem, and try and help them that way.
Because relatives do often think that they are imposing these conditions with the best interests of the person at heart, but that's because I think they don't understand the dangers. And like Paula says, we are here and available to advise on that support.
Brilliant stuff. Okay. I don't need a detox, but my GP told me to come. Paula?
Well, a lot of GPs do refer to us. They refer people into the service because it might be at that point when they've spoken to the GP, the drinking might be quite high, there might be harmful levels, and it might be that, obviously GPs, I think, prefer people to come to our service dealing with alcohol issues, which I prefer really, because they get, I'm not disputing what GPs do, they do a good job, but we're a specialist service that are able to deal with that. So it might be that, they don't need a deed. Depending on the situation, it might be someone's come in, they're having a bottle of wine a night, they might have expressed to the GP that, they feel like it's a little bit too much. Mm-hmm. And then the GP's referred to us. And then it might be that person doesn't need a detox. They might be able to reduce themselves on a structured reduction plan. So it varies really, but we do get a lot of referrals from GPs. And that's a good thing because, working together with GPs is important, I think. It's better to work together than to work alone. So, we welcome that, really.
Thank you.
Another one, do pre-gabs help me stop drinking?
I missed that one, sorry, what did you say?
Do pre-gabs help me stop drinking?
Easy answer to that, no.
No, they don't.
Can you just give us a bit of an explanation what pre-gabs are?
Pippa, you might be good at this one.
Not particularly. They are painkillers, but they work in a different way, and they work on nerve pain, and they probably take a couple of weeks to sort of come and have the best effect. But they are a kind of painkiller. They're not related to the alcohol pathways, and they won't have any benefit in trying to stop drinking.
Actually, taking them and drinking isn't
dangerous
idea either, is it?
No, it's very dangerous to take any painkillers with alcohol. So that, it can be fatal.
You know what, guys? I think we might have come to the end of the road. But I think it might be, it leaves everybody hanging a bit there. I don't know if any of you, if you were to leave a final message, a most important message to a service user about from a health perspective, do you think we could have that, just to lay that out there? Finish on.
One of the things I always leave a service user with, I've worked with them, I may have supported them with their detox, or they may have got to where they wanted to go. And one of the things I try and instill on someone as they're leaving my support is, please don't just stop the support, because it would be fantastic if you recognise that achieving what you want requires sort of behaviour change. And the way you change your behaviour is by continually working on it. So engaging in the groups, the psychosocial. The temptation is to put it all to one side now and get on with my job as a mother or as a bus driver, whatever it is, and that to the detriment of what you've just achieved, really. So please don't stop.
Don't stop stopping.
Yeah.
I think for me, it's about encouraging people to come into service, because I do hear from a lot of people that, there is a lot of stigma attached to substance misuse and mental health and other things. And we need to keep that aside, because, if you come into service, that is a massive step. It's about, realising what's going on and getting the help and support that you need. And that's what we're here for. We're a friendly bunch of people. We understand what's going on. You can talk to us, we can listen. So if anything, if anybody's thinking, oh, well, I don't really want to, please come and see us, because it although it might be a daunting experience, it will be a good experience. So we recommend people to come in and see us, and we're here. That's what we're for. So don't be ashamed, don't be embarrassed. It's about coming to see us, and we're there to help you.
And if you're comfortable with it, please do spread the experience, because there are a lot of people out there that are experiencing problems with alcohol and substances and actually don't know where to go and what the best way forward is. So spread the word as much as you can.
John, do you want to have the last word?
Yeah, why not? I guess if I was to add anything indifferent to what everybody's added about encouraging people to come into service, then go on the East Lancashire Facebook page. And particularly this week, the emphasis being Alcohol Awareness Week. I know our wonderful peer mentors and volunteers have absolutely supported, including you, Jackie.
Well done, guys.
absolutely supported us in encouraging.
This is a girl who couldn't walk through the doors of Inspire 18 months ago. I was too embarrassed.
Well, fair play to you, Jackie. You've done well. Amazing.
And I think I've sat and I've listened to those inspirational stories and different people's journeys. And I think for anybody that's sat at home wondering whether to come into service or not, and is it for them, and they're fearful, and that's quite normal. It's understandable to be scared and fearful of the unknown, isn't it? Then just set some time out and sit and listen to other people's stories is perhaps all some people need.
Yeah, well, we're all more similar than we realise, aren't we?
We're all normal people, and people that are in service come to inspire. We're all normal people. I think once people get their foot through the door, they realise that it's not just for other people. It can be for you.
Thank you. I think that might be a wrap.
Yeah, that was a good end.
It's a wrap. It's a wrap. It's a wrap, baby.